Welcome back to our channel, where we uncover the health secrets that could save your life. Today, we're diving into the early signs of pancreatic cancer symptoms, so subtle and shocking that many doctors rarely talk about them. Stay with me, because knowing these signs could make all the difference for you or someone you love. What if I told you that one of the deadliest cancers in America is silently developing in thousands of people right now without them having the slightest clue? Every single year, pancreatic cancer takes the lives of more than 50,000 Americans. And here's the terrifying truth: over 80% of those cases are discovered too late. Imagine waking up tomorrow, thinking you're perfectly healthy, only to find out you've ignored the subtle signs your body has been trying to send you. That's the nightmare thousands of families face every year, and it doesn't have to be yours. But here's the hope I want to give you if caught early. Treatment can be more effective, sometimes even life-saving. That's why in today's video, we're breaking down the 12 early warning signs of pancreatic cancer that doctors say are most often overlooked. Some of these signs are so subtle, like unexplained weight loss, dark urine, or even persistent hiccups, that most people brush them off until it's too late. By the time we're done here, you'll not only know what to watch for in yourself, but also in your loved ones. Because awareness is the first line of defense. So stay with me, because what you're about to hear could mean the difference between catching cancer early or missing it until it's too late. And trust me, you don't want to be the one who says, "I wish I'd known sooner." Let's dive in. Let's start with one of the most overlooked early signs of pancreatic cancer: a sudden loss of appetite. Picture this: you sit down for dinner with your family, maybe a plate of your favorite pasta or a juicy burger, but halfway through the meal, you push the plate away because you're just not hungry anymore. At first, you might chalk it up to stress or being tired, but when this keeps happening, it could be a red flag your pancreas is in trouble. Here's why: your pancreas is responsible for producing enzymes that help your body digest food. When a tumor begins to grow, it disrupts this process, leaving you feeling full after only a few bites or making meals feel uncomfortable. Research published in the Journal of Pain and Symptom Management found that unexplained appetite loss and weight loss are among the most common presenting symptoms of pancreatic cancer, caused by malabsorption and nutritional deficiencies. In plain terms, your body isn't getting what it needs, and that invisible battle shows up in something as simple as your plate. So how can you spot the difference between a random off day and something more serious? Pay attention if your appetite consistently drops for weeks without clear cause, especially if it's paired with weight loss, abdominal discomfort, or changes in stool color. That's your body waving a warning flag. The smartest move: don't ignore it. Talk to a healthcare professional and get it checked, because the earlier you act, the better the chances for effective treatment. But just knowing about appetite loss isn't enough, because there's another early symptom that can appear even before pain sets in, and it's written all over your skin. And that brings us to a sign you can't ignore, because it literally shows up in the mirror: jaundice, or yellowing of the skin and eyes. Imagine waking up one morning, looking in the bathroom mirror, and noticing that the whites of your eyes aren't so white anymore. Instead, there's a faint yellow tint. You might think it's poor lighting. Maybe you're just tired. But in reality, this could be one of the earliest visible warning signs of pancreatic cancer. Here's what's happening when a tumor blocks the bile duct. A substance called bilirubin builds up in your blood. That buildup doesn't just cause yellow skin and eyes. It can also turn your urine dark, like tea or cola, and make your stools pale. And here's the chilling part in pancreatic cancer: jaundice often appears without pain, which makes it more dangerous because many people dismiss it as harmless. A study published in HPB in 2013 confirmed that painless jaundice is a frequent first symptom, especially when tumors form in the head of the pancreas. So how do you act on this if you or someone you love notices unexplained yellowing of the skin or eyes, especially if it comes with dark urine or pale stool? Don't wait. Seek medical attention immediately. Catching jaundice early could mean catching the cancer before it spreads. But jaundice doesn't always arrive alone sometimes. Your body gives you a much subtler clue, hidden in something as ordinary as the color of your urine. And if the yellowing of your skin and eyes wasn't enough of a warning, your body may whisper another clue in an even more private way: dark urine. Think about it. One day you use the restroom, and instead of the usual light yellow, your urine looks more like strong tea or cola. You might assume you're just dehydrated, but if you're well hydrated and the color still doesn't change, this could be your body's way of sounding an alarm. Here's the science when a pancreatic tumor blocks the bile duct. Excess bilirubin enters your bloodstream. Your kidneys then filter it out through urine, giving it that dark, brownish shade. What makes this sign so sneaky is that it often shows up before the more obvious yellowing of the skin or eyes, meaning your bathroom mirror might not catch what your toilet already knows. A 2021 study published in the British Journal of General Practice even identified dark urine as one of the earliest overlooked symptoms in thousands of pancreatic cancer patients, sometimes appearing up to a year before diagnosis. So what should you do? Pay close attention if your urine turns persistently dark, even when you're drinking enough water. If it lingers for more than a few days, don't brush it off as something minor. Get it checked by a healthcare professional. Acting early could give doctors the chance to intervene before the cancer advances. But the body doesn't stop there. Sometimes it leaves another hidden clue in something most people never want to talk about: the color and texture of your stool. And while urine might reveal one hidden clue, another sign can show up in a place most of us would rather avoid discussing: your stool. If you notice that your stools are suddenly pale, greasy, foul-smelling, or even floating, it's not just an inconvenience. It could be an early warning of pancreatic cancer. Imagine flushing the toilet and realizing something looks different, not just once, but day after day. That's your body signaling that something deeper might be wrong. Here's the reason: when the pancreas isn't producing enough digestive enzymes because of a tumor, fats from your meals aren't broken down properly. Instead, they pass through your system and end up in your stool, creating what doctors call steatorrhea. In plain English, that means stool that looks oily, pale, and unusually difficult to flush. A study published in Pancreas in 2016 found that many patients reported these stool changes months before diagnosis, making it one of the more subtle but critical early signs. So how can you tell if this is serious? Watch for persistent changes in the color or consistency of your stool, especially if it appears greasy or pale even when your diet hasn't changed. If this continues, it's time to see a healthcare provider and request an evaluation. Spotting this sign early could push doctors to look deeper before the disease progresses. But even beyond the bathroom, your body has another way of sounding the alarm: through persistent pain in your upper abdomen, a discomfort that far too many people mistake for ordinary indigestion. But sometimes the signs of pancreatic cancer go beyond what you see in the bathroom. They can be felt deep inside your body. One of the most common red flags is a dull, persistent upper abdominal pain that doesn't seem to go away. Picture this: you finish dinner, lie down on the couch to relax, and suddenly that nagging ache in your upper belly creeps in again. At first, and you might blame it on heartburn or stress, but when it keeps returning, especially after meals, it could be something far more serious. Here's the science behind it. The pancreas sits tucked deep in your abdomen, close to major nerves and organs. When a tumor begins to grow, it can press against those nerves or surrounding tissue, creating a steady discomfort that sometimes radiates straight through to your back. A study published in Anti-Cancer Research in 2020 found that abdominal pain was one of the most frequently reported early symptoms among pancreatic cancer patients, often showing up before more visible signs like jaundice. So how do you know if this pain deserves attention? Watch for discomfort that lingers for weeks, worsens when lying down, or feels sharper after eating. If it's not relieved by simple lifestyle changes, don't just write it off as indigestion. Make the call to your doctor. Pancreatic cancer caught at this stage is still difficult, but the odds improve dramatically when treatment begins earlier. But abdominal pain isn't the only type of discomfort you should worry about sometimes. That very same pain radiates into a place you wouldn't expect: your back. And here's where it gets even more alarming sometimes, that abdominal pain doesn't just stay in your belly, it spreads straight to your back. And many people dismiss it as nothing more than poor posture or a long day at work. Imagine sitting at your desk, shifting in your chair because of that stubborn ache between your shoulder blades or mid-back, thinking you just need a better mattress. But what if the pain isn't from your muscles at all? What if it's your pancreas trying to get your attention? The reason this happens is simple but serious, as a tumor grows inside the pancreas. It can press on surrounding nerves and tissues that connect directly to the back. That's why so many patients describe a dull, radiating pain that worsens after meals or when lying flat, but sometimes eases when leaning forward. According to a study published in World Neurosurgery in 2022, nearly 2/3 of pancreatic cancer patients reported abdominal or back pain as one of their first noticeable symptoms long before diagnosis. So what should you do? Don't brush off persistent mid-back pain, especially if it shows up alongside other symptoms like appetite loss, weight loss, or jaundice. If the pain lingers for weeks despite rest, stretching, or lifestyle changes, it's time to talk to your doctor. Your back may be telling you a story that has nothing to do with posture. But back pain is just the beginning, because in some cases, the disease doesn't just cause discomfort, it can actually disrupt your body's ability to regulate blood sugar, showing up in the form of something much bigger, sudden diabetes. And here's something most people would never connect to pancreatic cancer: new onset diabetes. Picture this: you're over 50, you've always had normal blood sugar, no strong family history, maybe you're not even overweight. Then suddenly, during a routine checkup, your doctor tells you your blood sugar levels are high and you're diagnosed with diabetes. It feels random, even unfair. But in some cases, that new diagnosis isn't just about sugar, it's about your pancreas signaling a much deeper problem. Here's the science: the pancreas not only helps with digestion, it also produces insulin, the hormone that regulates your blood sugar. When a tumor develops, it can disrupt insulin production, leading to sudden spikes in glucose levels. A study published in Gastroenterology in 2008 revealed that adults over 50 who developed new onset diabetes were more than twice as likely to be diagnosed with pancreatic cancer within 3 years compared to those without diabetes. That's not just coincidence, that's a powerful warning. So what's the smart move here? If you or someone you love is diagnosed with diabetes out of the blue, without the typical risk factors like obesity, poor diet, or family history, it's worth asking more questions. Don't stop at managing blood sugar. Talk to your doctor about checking the pancreas. Early vigilance could mean catching cancer before it spreads. But the surprises don't stop there, because sometimes the earliest warnings of pancreatic cancer don't show up in your lab results, but right in your gut, disguised as everyday digestive problems. And while a sudden diabetes diagnosis can feel shocking, sometimes the earliest signs of pancreatic cancer don't show up in your blood work at all. They show up right in your gut. Imagine this: you finish a meal and instead of feeling satisfied, you're left with constant bloating, uncomfortable gas, or even waves of nausea that seem to come out of nowhere. You might blame the food, think it's indigestion, or even chalk it up to stress. But when these digestive issues become persistent, they may be a signal that your pancreas isn't working the way it should. Here's why: the pancreas produces digestive enzymes that help break down fats, proteins, and carbs. When a tumor blocks the pancreatic duct, those enzymes don't reach your small intestine. The result: food isn't digested properly, causing excessive gas, fullness, nausea, and even vomiting in some cases when the stomach can't empty the way it should. A 2023 study in clinical colorectal cancer highlighted that gastrointestinal disturbances like bloating and nausea were frequently reported in pancreatic cancer patients, sometimes months before more serious symptoms appeared. So how do you know when to worry? If you notice persistent bloating, unexplained gas, or nausea that lingers for weeks without a clear cause, don't dismiss it as just something you ate. Your body could be waving a red flag. Talk to your doctor, especially if these issues combine with other warning signs like appetite loss or weight changes. Acting early can give you options that might not be available later. But digestive problems aren't the only way pancreatic cancer drains your energy. Sometimes it robs you in a much more profound and exhausting way through relentless fatigue and weakness that no amount of rest can fix. And while bloating or nausea can weigh you down after a meal, there's another sign of pancreatic cancer that drains you on a much deeper level: relentless fatigue and weakness. Picture this: you get a full night's sleep, maybe even skip the gym to rest, but by mid-morning you feel like you've been hit by a truck. No energy, no drive. Even climbing the stairs feels like a workout. This isn't the normal tiredness we all experience. This is an exhaustion that clings to you no matter how much rest you get. Here's why it happens: cancer cells are greedy. They steal the nutrients and energy your body needs to function, leaving you feeling drained. On top of that, when your pancreas isn't digesting food properly, your body absorbs fewer calories and vitamins, compounding the weakness. The American Cancer Society notes that fatigue is one of the most common symptoms reported by pancreatic cancer patients. And Johns Hopkins Medicine explains it as your body being robbed of fuel by the disease itself. So how can you tell if it's serious? Pay attention if your exhaustion is persistent, unexplained, and interfering with daily life, especially if it comes with other warning signs like abdominal pain, jaundice, or unexplained weight loss. If rest doesn't fix it, don't ignore it. See a healthcare provider. Identifying fatigue as part of a larger pattern could save valuable time. But fatigue isn't the only way your skin can reveal trouble. Sometimes the earliest warning shows up on the surface, in the form of relentless itching that drives you crazy and points back to your pancreas. And sometimes the warnings don't come from deep inside your body at all. They show up right on the surface. One of those subtle but maddening signs is persistent itchy skin. Imagine lying in bed at night, tossing and turning, scratching your arms or legs until the skin is red, but no lotion or cream gives relief. It's frustrating, exhausting, and most people never connect it to something as serious as pancreatic cancer. Here's the science when a tumor blocks the bile duct. Bile salts and bilirubin build up in the bloodstream. That buildup doesn't just cause jaundice, it can also trigger intense itching, known medically as pruritus. The Dana-Farber Cancer Institute explains that patients with pancreatic cancer often describe this itching as one of the most unbearable symptoms, sometimes worse than the pain itself. A study in the European Journal of Cancer Care also highlighted how unrelieved jaundice is frequently tied to relentless itching, a signal that the body's overwhelmed. So what should you watch for if you're experiencing unexplained, persistent itching that lasts for weeks, especially if it comes alongside yellowing skin or dark urine? It's not something to brush off. Talk to a healthcare professional right away. Relief isn't just about comfort here. It could be about catching cancer early. But the story doesn't end with itching because, in some cases, pancreatic cancer can silently change the way your blood flows, showing up as dangerous blood clots that appear without warning. And while itchy skin might seem irritating, there's another sign that can be far more dangerous and even life-threatening: unexplained blood clots. Picture this. You wake up one morning with your legs swollen, red, warm to the touch, and painful when you walk. You think maybe you slept funny or strained a muscle, but what if it's not muscle at all? What if it's your blood silently turning against you? Here's why it happens. Pancreatic cancer can make your blood more prone to clotting, a condition doctors often call Trousseau's syndrome. These clots usually form in the deep veins of the legs, leading to deep vein thrombosis, DVT, but they can also break loose and travel to the lungs, causing a pulmonary embolism, an emergency that can be fatal if not caught in time. Research published in Cancer Letters in 2024 revealed that blood clots sometimes appear months or even years before a cancer diagnosis, making them one of the most overlooked early red flags. So how do you know if you should worry? Pay attention if you develop sudden leg swelling, redness, warmth, or pain without a clear injury. And if you experience chest pain or shortness of breath on top of that, don't wait, get emergency medical help. While blood clots can have many causes, their presence alongside other signs like jaundice, fatigue, or weight loss should never be ignored. And believe it or not, there's one final symptom on our list that sounds almost too strange to be true: persistent hiccups that refuse to go away. And they may be your body's last early warning. And now we come to one of the strangest and most surprising early warning signs of pancreatic cancer: persistent hiccups.
Of your diaphragm.
At first, it sounds almost laughable. We've all had hiccups after eating too fast or drinking soda, and usually they disappear within minutes. But imagine having hiccups that just won't quit, lasting for days, even weeks. You try holding your breath, sipping water, chewing sugar, but nothing helps. It's not just annoying, it could be your body signaling something much more serious. Here's the reason: when a tumor in the pancreas presses against the diaphragm, the muscle that controls your breathing, it can trigger uncontrollable spasms that show up as hiccups. Research published in BMC Cancer in 2022 revealed that 15 to 40% of cancer patients experience persistent hiccups, with a subset reporting episodes lasting beyond 48 hours. While hiccups alone are rare as a warning sign, when they appear alongside weight loss, fatigue, or abdominal pain, they become an alarm bell that's too important to ignore. So what's the takeaway here? If hiccups last more than 48 hours, or especially if they persist for weeks and come with other symptoms we've covered, don't dismiss them. Talk to a doctor. What seems like a harmless annoyance could actually be an early sign of something deadly. And now that we've uncovered all 12 hidden warning signs, from appetite loss to hiccups, you'll see how powerful it is to recognize these clues early. But the bigger question remains: what can you do next to protect yourself and your loved ones? Let's bring it all together. Let's bring it all together. We've uncovered 12 early warning signs of pancreatic cancer, from appetite loss, jaundice, and dark urine, all the way to blood clots and persistent hiccups. These signs may seem small on their own, but together they tell a story your body doesn't want you to ignore. Remember, early detection is not just about adding years to your life, it's about preserving the quality of life you deserve. If you've recognized any of these symptoms in yourself or a loved one, don't panic, take it as a call to action. Reach out to a healthcare provider, ask the right questions, and don't be afraid to advocate for your health. You are not powerless in this fight. And because your health journey doesn't stop here, make sure you save this video so you can revisit these life-saving signs anytime. Hit the subscribe button and turn on notifications so you never miss our latest health updates. We're creating new content every week to help you understand not only cancer risks, but also how to protect your kidney health and overall well-being. Your support helps us reach more people who may desperately need this knowledge. Most importantly, don't lose hope. Medical research is advancing every day, and awareness is your strongest weapon. Stay informed, take care of your body, and remember you are not alone. We're here to walk this journey with you. Until next time, stay healthy, stay strong, and take care of yourself and your loved ones.